Hello and welcome to another episode of the Melbourne Athletic Development Podcast. Today, I'm joined again by Jack.
Here as always.
Now, we wanted to actually discuss a follow-on from the discussion that happened in our podcast last week with David Woods. We felt like it obviously ended a little bit early. He had some commitments, so we couldn't necessarily extend it, but there were some ideas in there that we thought were really important to expand upon, and we wanted to kind of keep that conversation going at some level, because I know that you were very aware of the fact that some people might be questioning even why we were talking to David about creativity and artistic pursuit. So I think it's worth starting at that point. You know, why are we talking to people about such things?
Well, yeah, I think when you listen to it on the surface, you think, how do you draw correlations to what you do in terms of rehab performance? But the reality is, I think there is a lot to be drawn from the concept of creativity. But I think also, too, some of the topics that we talked about with pursuing knowledge outside of fields or areas that you may see as being necessarily related to what you do. Because there's actually a lot of things that you learn along the process. And we touched on specifically about trying to alter someone's perspective and the importance of psychology on performance, which is a pretty clear one. But I think most of the time people associate that with, say, going to see a sports psychologist and learning some, good tools about how you manage stress or perceive yourself. So, well, this is something we've talked about before, and that is, as a coach, as a clinician, what is your job? And we've talked about this in the most simplistic way of, I see our job as to solve problems.
Yes.
Now, specifically as a clinician, as a physio, typically we're trying to solve musculoskeletal problems. And we definitely live in a time where the problem-solving method we have is very much find a diagnosis, apply a recipe.
It's quite formulaic.
And we've talked about this before of, well, how do we actually start thinking about how we solve a problem like in the human system? Part of this is about thinking about kind of a problem that you're dealing with.
Well, I think the big thing that came out of that discussion was really understanding the psychology of individuals and how you need to interact in a way that is aligned with what that person is trying to achieve, as well as the way in which they can work. And I think David was really good at being able to articulate that your whole point is to kind of navigate that space to bring them along for some sort of journey. And I think we've been talking about this a lot, obviously, even from just a business perspective.
And its relationship to psychology.
The psychology of, patients and how they view what you're doing, because if you're not able to take them along for that journey, you actually get much worse outcomes. And it seems like you're having to tap into some of these skills that aren't always spoken about, and they are the softer skills. They are things like bedside manner, but they're really important. And funnily enough, talking with Dom, who works with us, recently said, he sent someone off to see a surgeon. And this surgeon's a fantastic orthopedic surgeon and is really clear with what they say. But the feedback that you always get from patients is that their bedside manner is very blunt, doesn't show a huge amount of empathy, and doesn't always instill a lot of that psychological safety sort of aspect in the patient. However, obviously builds trust through their competence as a surgeon, has good results and is very, very confident in their ability to carry out certain outcomes. So it's a really interesting interplay, because the feedback that you always get is, oh, that wasn't that enjoyable of a consultation experience.
But, straight away it makes me think of, too, when thinking about David. What does David do? He is a performer. In reality, when we work,
we're performers.
There is a performance. There is a story and a narrative that a patient or a client has, and an expectation. And you may or may not fulfill that expectation or the story or narrative.
It's like David was saying, you go to it, he would be performing a show, and some people would just walk out because they're like, this is not the expectation I had of what this performance was.
Totally.
And in that setting, you're doing it obviously for some sort of creative pursuit. And as you said, it's that interesting line between them balancing the commercial aspect. And for us, weirdly, as health professionals, you are balancing that commercial aspect because you might be the most competent clinician, but if no one ever sees you, then you need to get another job.
Yeah.
Right? So it's a really interesting game because you need to understand, as you said, how to build that performance around the expectations of that patient. And that's not always easy to do because you get people from very different walks of life.
Yeah, so I think as we start to unfold this more, it makes me think of a couple of things about creativity. Because there is creativity about how do I solve that problem, injury or pain, but there's also the creativity of how do I ensure that that person feels that I'm taking them on the journey that they expect. Like this is something that we have talked about this week too, about having clarity with outcomes and having clarity with intentions. Because just to give some context, when we think about working with a patient, ultimately the thing that we're thinking about is like, one, we want you to have a good outcome, whatever that is, and two, we want that to happen as soon as possible. Yeah,
I think that's the key thing. Your job really is to say, like, it sounds dumb, but you're wanting to discharge them as soon as possible with the best outcome available. And it seems silly because obviously it's counterintuitive. If you can keep them coming back, you'll obviously commercially, the commercial realities, you'll make more money from that. But that's not necessarily going to get you a good outcome in the long term. If you're much more clear on what you're trying to achieve, you potentially have the opportunity, even if you think about it from a business sense, you may actually have more opportunity to charge more if you can say, I can maybe not guarantee, but I have good evidence based on my experiences that there's a high probability I can get you from here to here with this information and this input, and I can do it in this period of time. If you can show and demonstrate ongoing success with that, and people start to know, as I was saying, like the surgeon, if the surgeon shows a high level of success with knee replacements or ACLs or whatever it is, then people go there going, I'm there for the outcome. And that surgeon can then potentially charge more as well. So it has that effect on the commercial aspect if you're thinking, how do I get this outcome for this person?
Yeah, it's the thing I just sort of then too, I think of someone like, again, talking to David Woods. He's someone who's clearly very creative. He's someone who's clearly very artistic. And he's someone who's very also, some of those traits I wonder whether they are associated with that real openness.
Yes.
And ability to have conversations about things that they may or may not agree with. And the ability to take on new bits of information. Because I do wonder how creativity does allow you to be more comfortable with uncertainty. And maybe we can use the other end of the spectrum. And this is a gross generalization, I realize, but thinking about orthopedic surgeons, where there seems to be a certain stereotype about orthopedic surgeons. But I think the way that they think is in very certain...
It's very binary.
Yes, very binary terms of you do need surgery, you don't need surgery. If you do need surgery, we're going to fix the problem, and this is the outcome. And total gross generalization, because we've obviously met plenty.
Yeah, we've had some fantastic surgeons who don't think necessarily in such concrete fashion.
And there's something appealing to that. And certainly I think something that we all need to be able to do is to be able to identify certain psychological traits in the people we work with to understand what is their psychological profile and how do they respond to how you word things.
Well, actually, it's an interesting question because I think about this myself. I've thought about this a lot because I'm not a consumer, for instance. Weirdly, I'm not a consumer of healthcare generally. And I've actually thought about why. And I think because for me, I am very much like what you're describing with these patients. I'm binary. I want an outcome. So unless I think I'm getting a specific outcome from a healthcare professional, I'm not going to them.
Yes, okay.
Right. And, I'm lucky in the sense of, physical injuries generally. I don't participate at sport at a really high level. I do some general exercise, but I'm not doing enough to get injured. So physically, hopefully I could also, help myself in some ways by doing, what information I have in my own sort of skill set. But say, for instance, if I was to go, say some sort of medical thing, unless I'm going to the doctor because I know like I need an antibiotic or I need this, I won't go.
Yes.
because I'm looking for a specific outcome, and I'm weirdly binary in that sense. So I understand why patients think that way because I think that way. So if I came to me and no, I'm serious. If I came to me and I was verbose and not giving a really clear, like, oh, how long is it going to take for my hamstring strain to get better? And I was like, oh, it could be this. I'd be like, I'm not going back. So I'm really careful with that, with my language, and saying, this is what you've got. This is what I expect based off the experiences that I've had. These are the contingencies we put in place. If that doesn't work, then we're going to explore this. It's that straightforward, right? And I know that I do that sometimes even to appease my own psychology of that's how I would like to be treated, which is not always right because some people don't view it that way. But I think that it's very heavily intertwined with, what we discussed a little bit with David, which is that the world is more and more uncertain. We have less and less time. Our attention span is shorter and shorter. So if you're not going to give a really clear, well-defined time frame to people, they really struggle with the idea that there's an open-ended outcome.
How do you deal with the situation then if there is less certainty in your...
I think you just have to be really honest with it. Like it's actually very jarring. And I'm in discussions at the moment with some people at a couple of different universities talking about a project ACL injuries. I don't know if I've spoken about this on the podcast, but I currently believe that the solution we have for ACL injuries is terrible. It's a really, really poor solution. It's a minimum of 12 months back to reasonable level of activity. Probably 2 years is a better, if you look at the statistics, 2 years is probably a smarter time to do it in terms of the safety of return and re-injury rates. The knee is never the same. The degradation and likelihood
the performance of people is usually never the same.
The likelihood of early onset osteoarthritic changes is quite high, or very high.
And not necessarily different to whether you get surgery or don't get surgery.
These are the things that when you think about that, make you realize, okay, that's not a great solution.
No.
And one of the reasons why I'm interested in being involved in this project is because I really don't like the experience that often gets left to us as the physio to explain to people this very scenario. And it's really interesting talking to people because, I think as you get more experience as a clinician, you can be a little bit more direct because you're more confident in what you do know.
Yeah.
So you say to them, all right, so you're aware, this is how long it's going to take. These are the reasons. This is what the likely outcome is. And be aware that your knee will never be the same. You're likely to have early onset OA. We need to think about that in the future. You need to look after this. They look at you with shock because it's often one of the first times in this experience where they've already had typically a very traumatic episode of injury.
And they have an expectation that they're going to go back to quote unquote normal,
And the surgeon says to them, yeah, we'll be able to repair or reconstruct your ACL and you're going to be back at sport. And they might tell them it's 12 months, but you say to them, okay, like fundamentally your knee will never be the same again. The answer I have is not a good one, which is that you just need to be very open and clear with people about what the outcomes are. But that experience is a really interesting one because, as I said, you have this very quick change in the person's emotional state. They go, oh, I wasn't aware that this was an ongoing thing. As you said, they believed that, for instance, they were going to have a complete resolution.
And you see that's also in people's behavior who start the rehabilitation process, but after a few months disappear because that commitment to
that wanes,
maximizing their outcome,
it wanes. Yeah, because the motivation to maintain that is not there. And so unless they're going, especially the ones that I find that are the most difficult, and I don't blame them, are the ones who they're not trying to get back to a particularly high level of activity.
Yes.
Because the end target is not there. And so for us, it is in many ways similar to what we spoke about, David, but it's different. It would be analogous to us having to try and get a particular outcome from the audience. You're trying to get a specific laugh, or you're trying to get them to experience a particular emotion. for us, we're trying to get an outcome and we're trying to get them to come along that journey, and we've got to adapt to them rather than saying, no, this is my expression of my knowledge.
Yeah, and you have to somewhat try and force the outcome. Because ultimately the outcome is, I want you to have less pain. I want you to get back to playing sport. I want it, whatever it may be.
And you've got to be able to put in place those strategies clearly and outline them so that that journey can happen. That's not always easy to do. And in fact, it's often very difficult to do because people have such different varied, understandings, expectations, cultural biases. And that's, as David said, you don't know how people are going to react.
Well, that actually brings up another point we talked about with David, and that is how people actually deal with that kind of confrontation as well. Because I think...
some people just walk out.
Well, and look, it's actually something too...
Not in terms of patience, but in terms of...
Well, you don't hear from them again, potentially.
Oh, that's true. You do lose patience sometimes where you think that you've actually gone through a really well-planned, structured, strategic approach.
And honest and objective.
And you've done everything you can. You've done follow-up. Maybe they need to have a referral to see a sports doc or a surgeon or, podiatry or psych or whatever it is. And you're like, okay, yeah, I did everything that makes sense. It's sort of, I'm not going to say protocol, but you followed as closely as you can to what is best practice. And then they just disappear. And you're like, I don't understand. How is that the response that I got?
Yeah, and well, I'm not necessarily sure the solution of this is, but it does highlight another problem that we talked about with David of the directness or lack of directness that we have in society towards each other, and actually how that influences what you do in your professional world as well.
Well, it's funny how he was talking about that. I'm traveling, you would have noticed this, traveling a lot now. I actually spend a fair bit of time, I don't know why, thinking about what the general, shared, and it's culturally influenced, but shared sort of personality of a place is. And I think I've mentioned this to you before, but like I laugh because my background is Italian. I go to Italy for the first time last year, and I realized this is genetic. I understand some of my volatility emotionally, because that's how they operate, right? And David brought up the German gentleman. He's undeterred, gets up and just does the same thing over and doesn't understand why the French director saying get off. Like it's the same thing. Well, there is that. I know you've mentioned that about a patient you have that has a particular ethnic background. Is it like, oh, they're such a stereotype of that background, and you're not saying it in a negative sense, but it's just like it puts it into context for you.
But and again, we're going on different tangents here, but I think about the conversation of creativity, and one of the things that's very evident when you think about reading and reading fiction is it actually builds empathy. Yes. Because it gives you insight into looking at things.
I never thought of that.
Yeah, well, it gives you insight into looking at a story being told from someone's perspective. And obviously, very good writers have the ability to create characters with certain types of traits that often are very in contrast with each other and can actually tell a story through the lens of different people.
You know what I actually thought about with this is how clever writers are at being able to get you to, for instance, feel some sort of connection with a character that is often a horrible character. I know, like, for instance, even for those people who would have seen it more recently, what was the you would have seen it, they won a number of awards. Oh, I've lost it, but it's the one with Leonardo DiCaprio and Robert De Niro, and they're on. It's about like the American Indian involvement. The Martin Scorsese film, I believe.
I'm not sure if I know it actually.
Apologies, but I've actually lost the name of it. This happens to me too often, actually. But essentially, the one of the characters who's played by Leonardo DiCaprio is one of the main characters.
Killers of the Flower Moon.
That's right, correct. Yeah, you've seen that, Jack?
No, I actually haven't.
Very, very good film. But Leonardo DiCaprio's character, you want to love him, but he is one of the worst people you'll ever see. It's just like a horrible, horrible, horrible person, and he's watch it. It's a very interesting, but weirdly, the way that it's structured and written and directed, you want to like this guy and you want to be on his side, but really you should hate him and you should think this guy is just such a piece of shit. And it always makes you think of like, how do they get you to feel this? And it shows the complexity of people, that they're not as simple as good or bad. They have these other areas that you need to understand, and
including fundamental flaws.
We all have, massive fundamental flaws that we sometimes don't recognize. And this, I think, plays out heavily in our ability to work with an individual, because you see this play out. You present something to them and you've got to be creative about how you present it, because you know that if you don't, you'll lose them. And it sounds weird. You're like, I'm doing everything I can to help you, and it's really objectively clear that I am, and yet you still don't want to engage with it, which doesn't make a lot of sense unless you start to understand the complexity of, they feel vulnerable about their failure of their body, or, they're scared of what commitment that requires in an uncertain outcome, and all of those kind of things. So it's demotivating to them and they don't want to come, and it actually has nothing to do with your performance as a practitioner, but you need to engage with that and find a way of communicating that gets that out of them.
For sure. And look, you use the example of yourself of terms of what expectations you would have with seeing a health professional, which is fair. But I do think about like what other people do expect and are looking for when they go to see a health professional as well. Because I think for a lot of people, it can be even something as simple as wanting to be heard.
That is such a good point.
Yeah, and I think of...
People want that. They want the idea that someone is listening to them about their pain or about their problem.
And I think you and I have talked about this before, because you and I have this trait in common, which actually can be a problem.
A big problem.
is because we've got experience now, we know when we see a problem where you're like, okay, this is a problem, we need to address this. But the reality is most of the time you're like
you know what to do.
You're going to be all right.
Yeah.
But that kind of language can be very problematic, because a lot of people who are like, no, but like my back's in a lot of pain. You're like, no, like I'm not suggesting that's not, but like
you'll be okay.
I think it's clear about what things we need to address, and here's the expectation. But you have to be careful with that, because that may not align with what people are looking for, and not acknowledging the fact that they are in pain and that is affecting their day-to-day function.
And for them, potentially this is the worst experience of discomfort they've ever had in their life. And if you're overly calm or not dismissive, but you're not acknowledging the level of severity in a way that they would like to feel like they've been heard, as you mentioned, it can be really off-putting for them, because they're like, oh, they don't seem to be even concerned in the slightest about me. And it's not the case at all. It's just that, as you said, you've seen this behavior in a clinical symptom kind of play out so much that you're not concerned that you won't get a good outcome.
Yeah.
But you've got to be really clear and say, okay, this is not good. We want to see this. These are the steps we need to take. You almost have to say it without necessarily saying it, but you have to prove to them, I'm taking this very seriously.
Oh yeah, for sure.
Whereas they can interpret that you're not taking it seriously, not because you're doing anything different, but just because of, you're very relaxed and calm about the situation.
And I also wanted then too, because I think you and I are similar, where I read a lot, but I don't know, 98% of what I read is nonfiction, because I really like to learn about things and understand different concepts. And the last couple of years, I've been really trying to learn about structures of economy and finance, which is not really related to what I do, but it's also very, factual. And I compare that, say, to my girlfriend, who reads a lot of fiction, 98% fiction, well, maybe not that much, but certainly
a high percentage,
majority of it. And her ability to empathize and understand perspectives, and that's almost her default, is very different. And it's not to say that I think I don't lack that. I think I do, but I think I often can be more leaning towards
with the rational kind of
course, of like, here's the problem, here's the solution,
which I think is actually, and again, this is a generalization, but is typically more of a male trait
for sure.
You spoke about memes in the thing. It's like there's always those memes between couples.
Yes.
A female wanting to emotionally, like have that reassurance, and a male offering solutions, and she's like, piss off, I don't want an actual solution, I just want you to listen to me, which a lot of the times is exactly this. They want to know that you are on their side and that you're supporting them. They're obviously an intelligent individual. They can work out the problem if they need to.
And I think you and I, if I may say so, I actually think that you and I are actually very compassionate people, but the way that we express compassion is very different too.
Yes.
And it can be a little bit more, what's the word? I guess a blunt in the tool of like, no, like, you can get better. But these are the things that you have to do. And part of that's also, like, I think you and I are very similar. We want to actually put the responsibility on the individual to an extent as well. But it then actually makes you think about, well, how do you start to better understand the psychology of individuals? And like, there is obviously some type of intellectual pursuit about understanding psychology and personality traits, but it also makes me appreciate the importance of fiction too, to actually think about how that does actually give you an opportunity to experience different perspectives based on obviously the writer and the experiences that they have, which often are going to be very reflective of their own upbringing and certain characteristics of.
Well, I think that's the thing that we spoke about, and I mentioned that I was probably quite disrespectful to what the creative pursuits do, is that it actually gives you that opportunity to explore ideas and personalities and people and, as you said, perspectives that are potentially so far away from your own. And that in itself is the learning experience. And you can't get that if all you do is take on very objective information in that, as you said, that non-fiction sense where you're it's basically confirmational bias. You're like, this is how I think about the world, and therefore I'm going to continue to seek out people who think in the same way and consume things only through that lens.
And that is a large problem in society in general, and it's actually something that we have to be careful of, not using your ideology as like a sledgehammer to bend the world to your demands, because you may think that you have clarity on what you're doing and that you're providing the best treatment, so to speak, but that actually may not be perceived in that way from the person that you're working with.
It reminds me of, you remember the conversation that we had with Richard Newsham-West, where he said, we had, when he was working with compensable agencies, they had a clinician. No,
that was with Paul Coburn, wasn't it?
Oh, was it Paul Coburn?
Yeah.
It was with Paul. Sorry, apologies. It was Paul Coburn. And he's saying, we had this clinician that they were getting extremely good objective outcomes, but we couldn't work out why. We couldn't work out what they were doing, because there was nothing that they were doing. It wasn't controversial, but there was nothing that they were doing which was far exceeding that, the best practice model.
Yeah.
It wasn't particularly different from what other people were doing, but the outcomes they were getting were enormously different. And I think that so speaks to that clinician's ability to engage with that person at the level that they're ready to engage at.
The other thing I think that's worth exploring here too with creativity then is about how you put together some type of treatment or management plan. And again, this is something that we talked about with David, because people who are in the arts, particularly the ones who are really good, there seems to be that real grey zone that when you enter a certain state of mind, it allows you to express yourself in ways that you couldn't as opposed to being in the much more sort of objective reality. I don't even know if that's the right way to put it. Okay. But like, I'll give you an example. I think of, say, we've had an interview we did a podcast with my brother, who's a classical pianist. And you actually see, and Tom comes across them all the time, where you might get this 12-year-old kid who has already done their A mus in piano.
Which is super high level piano.
Yes. So for
grading,
exactly. So for my brother, he did that himself, but he did that when he was, I think he was like maybe 16, 17.
Yeah. So you've got this phenomenal junior, like,
Correct.
young
Yes.
phenomenon. Yeah.
And this is not always the case, but often when you have these kids who achieve such a high level of musical skills at a young age, they may have the technical ability, but they don't have the expression of understanding the music. And that's something that you hear a lot of musicians say, that you can hear it in their performance, where they have the technicality, but they don't have the expression, the emotion that comes out in how they actually play the instrument. And sometimes you might see that also within their physical presence as well, and how their facial and body language is expressed. But a lot of it also comes from the sound. And I often think about that very similar type of analogy within our profession. And it's something that actually, and I think we've talked about this a bit before, but we're a long way away from this now, where once upon a time you would have some brilliant clinician who would go up on a stage with a patient and actually go through doing an assessment and a treatment. And these are like, your Mulligans and your Maitlands and all these really great clinicians you heard about, who are often very creative and innovative. And they often express how when they finished treating the patient and had a good outcome, they could reflect back on what they did and provide some logic to what they did. But in the moment, they often talked about the intuitive sense of what they needed to do in terms of, I think I need to, they got low back pain, but I think I need to look at their, thoracic, and there seems to be
the hip's a little bit this, and I can feel there's restriction in this joint.
Correct.
I'm going to work on this a little bit.
I'm going to see if I, use this intervention to change the tonicity of this tissue or change the fascial mechanics. But they probably don't even necessarily.
They're just feeling like, I know that I can't remember who, it might have been Richard that spoke about, like, they actually just feeling and going, oh, that I think that I need to work on this, just by the palpation, and that's
and it's also, I think too, it's based on the fact that they actually have obviously very sound knowledge in basic principles. So like in terms of understanding of anatomy, of the restrictions anatomy here, that's probably more related to this particular myofascial plane, or whatever it may be. Or, well, I know that, this type of treatment at this depth will lead to this type of change. Like they have a sound knowledge of it, but they've reached a point of understanding those principles that when it comes to applying them clinically, they're so in the moment that they don't necessarily have to logically explain or rationalize what they're doing, even though retrospectively they can, because they have a sound knowledge base that have enough experience with that knowledge to not have to intellectualize it all the time. And it's a far cry from, I think, what happens now, because in many ways I feel like a lot of stuff that you see within our profession is about over intellectualization.
Totally.
And your justification of being right is about the ability to explain it in the most scientific terminology possible, not necessarily as an expression of what you've seen from your own clinical experience.
The thing that I think also colors this, which is something that we have spoken to a few people about, but is the influence of the legal and insurance schemes in our behavior, because that clearly does change people's willingness to be creative and explore these things. There is much less protection for you if something does go wrong, if you have gone significantly away from what would be considered best practice, right? And unfortunately, that term, of evidence-based practice or best practice is ambiguous to start with anyway, because as we've spoken about a million times, it comes from a particular model that does include things like clinical experience and patient expectations. However, there's a lot easier, tangible outcome that can be sort of demonstrated through pointing to this literature or this body of evidence or these particular outcomes or objective measures, which is not the same as saying I did this because the patient had made this request. They were looking for this type of outcome. Like a really silly example would be, and hopefully this never happens to us or to anyone, but say for instance, if every now and then you'll get a patient who really actually likes a certain modality of treatment. They're like, oh, I really like needling? Can I have dry needling done?
Mm.
The worst thing that could possibly happen in many ways is you don't necessarily think it's the best option, but you also don't necessarily think it's contraindicated, or you don't feel like it would be negative. You feel like it would have some positive benefit. You do it, and then the patient has some sort of adverse outcome, whatever that is. Maybe it bleeds and it gets infected, and then they end up on antibiotic, and they come to you and say, "Oh, you did this," and blah blah blah. And it's like, you specifically asked for that, right? Where does that place you? I think that's a really interesting.
Well, actually, you make me think of another story of.
Or at least that one was a made up one. So if you got one that's like that to you.
Yeah, this is of a story that I've heard of someone seeing someone with a long-term problem. I can't remember what it was, like chronic shoulder pain or something like that. And they had been seeing this patient for quite some time, several months. And they felt a moral dilemma because they didn't necessarily see the improvement that they would expect from this person, understanding that they literally had pain for years and years and years. And so making sure that they felt like they were doing right by the patient, the person said to them, "Look, we've been doing these things for the last few months. We haven't seen much progress. You're still getting these issues, blah, 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 blah. I'm not really sure what else I can offer you. I'm very happy to refer you to get a second opinion from some specialist or whatever it may be." Patient didn't say much. And then sometime later, that clinician called that patient to follow up and see what they were doing. And the patient actually said to them, "I was actually really upset after our last conversation." And the clinician said, "Oh, well, why is that?" And she said, "Well, I actually was getting a lot of benefit from those sessions. I found that every time that we did work, I found improvements in the overall pain and symptoms. I saw improvements in my function. And, I felt like you just gave up on me, and I actually was getting a lot out of it." And this person actually ended up, apologizing, saying "Look, understand that I'm very happy to work with you. But, I also have a moral obligation to think of, I wasn't seeing the benefit that I would expect to see. And I want to make sure that I don't feel like I'm just taking you for a ride here, and making sure that if there is another option out there, or a better treatment modality, that you're
exploring it." Yeah.
And it was an interesting experience because it was the first time where, and I'm sure a lot of it also had to do with the fact that this person obviously had developed rapport with his clinician, and respected this person, and found therapy in actually seeing them.
And the fact that, they probably felt that clinician was doing everything that was possible.
Absolutely. So it just makes you think then too about you make the explain about following best practice. Because I also think about in that situation, a lot of the time, regardless of what you do with someone, they'll probably get somewhat better.
Depends on what it is.
Of course. I'm talking about within reason, but I'm talking about if you just follow, here's the general guidelines, you may see some improvement. And as you mentioned before, you actually may see that the patient has a lot of satisfaction because you provide certain care that they see of really real value, particularly with developing rapport, particularly with showing compassion and satisfying what that person is expecting. So it often then makes me think about, well, when you think about creativity, what are the things that you do need to focus on? Because I think a lot of the time I think, are very much focused on thinking about how we improve the interventions we use. And I do think that's really important because you do start to see that there is a much better outcome when you have a much more tailored approach. But I think the other big one is how you actually develop some of those softer skills to make sure that you feel like you can provide a message and engage with someone in a way that they see satisfactory, and understanding that actually in itself also requires a lot of variability and tailoring as well.
The question then becomes, how do we develop these kind of skills to be able to bring someone along for that journey? Because as you said, that is a creative pursuit. That is your ability to adapt in the moment. And some people intuitively do it. They have
those skills already.
They have those skills, and they're personable people. They can adapt, and they move within different, social circles, and they know how to interact with people. But do you think that as a clinician, there are ways to develop that? I don't know, I haven't thought about this, but and you haven't had time to think about it, but do you think there are ways to kind of develop that, chameleon-like behavior of shifting towards that person?
Well, actually, I actually think one of the most useful things, and it's actually probably, I think, one of the big issues we see in society, is to have conversations with people who see the world in a different lens. And that often can be related to, we might have strong beliefs about political stances or like geopolitics or whatever it may be, and actually seeking out opinions that disagree with you.
It's so interesting to say, because I know that you described this, you had a conversation with someone the other day outside of this environment, just in your personal life, but you're talking about something and then they just, I don't want to talk about that.
No.
And or, like, I'm not willing to listen when it comes to that. And you were like, okay, interesting.
Well, and it's funny actually, because we were talking about this a little bit before, because I actually see the exact same issue when it comes to developing creativity and different skill sets that you use professionally. And like the most obvious example I think of, we're physiotherapists, you don't necessarily see a lot of engagement and collaboration with osteopaths, with chiropractors, with mytherapists, whatever it may be.
It doesn't make sense because we all have similar skill sets with slightly different experiences, and that's going to give us the opportunity to understand how to see it, as you said, from those different perspectives, which may very much allow you to adapt to that individual. And
it's like, this goes back to understanding that we all have preconceived ideas and biases and egos too.
I think you're 100% right of, thinking about it on the surface. Like, you need to engage in consuming information, consuming content, consuming even just conversations and ideas that go outside of your understanding, but also potentially challenge your understanding or a stance, maybe even polar opposite to yours. And your job is to try and understand why that person or that viewpoint is so polar opposite to you.
Yeah, and your job, I mean, this is, I think, probably could be applied just to even your personal life, but certainly your professional life, is the thing that you think you don't need to work on is probably the thing you need to work on the most. That preconceived idea of like, well, no, psychology is not important. If I'm a really good clinician,
that doesn't matter.
It does, yes. Or like, I'm not going to interact with that profession because I am superior and, I'm from a higher profession. And I see that too, like with creativity, and I see that the value with things like the arts, because it does provide you with thinking of things in a different way. And like that also can include like being involved in the arts, And like, I know David used that example of the New Zealand All Blacks learning to play instruments, which I imagine on the surface a lot of people going, that's just a bloody waste of time.
To be honest, I see that as a waste of time.
Well, see, I don't. And like, I mean, don't be wrong, if that's taking up, 30% of their training, I do, but I don't in the sense of...
Why do you not?
Because it provides them with, I'm making an assumption here, that a lot of them may not have musical backgrounds.
Yeah.
Some they may, for all I know.
They're all classically trained musicians.
Maybe. It's pushing them so far out of their comfort zone and developing a skill set that I think allows opportunities for you to think about things in a different way. And I think about how that may then translate into things like patience and discipline, but then also with like creativity and how that even influences.
I guess the reason I say I don't know, and I'm not completely against it, but I feel like it may be too many generations removed. That I feel like there's opportunity to do creative things within
that's fair
the rugby context, because
otherwise you can start to make assumptions that anything is going to help your high performance, I guess. Yes.
Anything that has value, which any skill set, doesn't matter. There might be managerial skill. Like, we're all making them do a leadership course at Harvard. It's that probably is going to transfer, but like, how quickly and how many generations removed is that? And
what percentage change do you expect?
Some of the people that once they finish the course, they're off the team anyway because their performance is diminished, or they got an injury.
Hey, you're focusing way too much on that management course you were doing. We need you to train more.
I'm playing at the Philharmonic. I actually can't play on the weekend.
I've actually realised that my real passion
is the violin.
Well,
as I said, that's why I think like is it too many generations removed?
Sure.
You know, and it's interesting because he said, like, I'm doing this mentorship with Dan Pfaff, and Dan's a really interesting character, and obviously a very, very successful coach. And I just remember seeing him do a talk actually for Athletics Australia. I believe it's online actually. People can access it, I think, on YouTube. But it's him talking about mental skills. And he said, like, mental skills are not you sitting up on a mountain, you know, meditating in, you know, cross-legged position. He's like, I've never seen that transfer to someone standing on the 100-meter start line and being able to get the performance at the right time. You know, and he's the guy that would know. You know, he had a guy.
He's done it.
He had a guy break the world record in the Olympic final, right, and win. Like that's
as high as you can get. Yeah.
You can't get any better than that. Yeah. So he knows what kind of traits are going to foster, and some of those things we spoke about, like they're inherent traits. But if someone's inherently not particularly open or creative, are you taking up time, even if it's a small amount of time, and are you going to get the value in that? You know, I don't know that you necessarily will. Also, too, like potentially those guys, by the time they've actually developed some of the transferable skills, as I said, they might be out of the sport. They might be injured. They might be, you know, the end of their career, whatever it is.
Well, and look, I don't see it as, oh, yes, you getting good at violin is going to help. It's more the pursuit of that skill. And I'm sure that's probably a lot of the justification for the, you know, for the performance management team. But I do think it actually is reflective, though, too, when we think about its application for our world. There clearly are skills that each person does need to work on. And
do you think that if, for instance, the way that you say, like, because I'm trying to think about how to make it as aligned and practical and applicable to people right now, and even for my own practice, because I know that I need to get much better at this, is when you do write your, you know, whatever plan you've got, you know, and you're writing your notes and you start thinking, okay, like I want to do this with them and this is, that you actually start to think of alternatives. And you go like, what's another way in which I could approach this? What are the, you know, it's almost, we always think about different, I know it's even within our notes, like differential diagnosis. You almost need to think about like differential management plan.
Yeah,
like,
well.
You know, what's another way I can get to this?
Yes.
Without necessarily doing what I would normally do. And I think that maybe like starts to open those parts of your thinking that opens up creativity, so that you know you're getting the outcome without necessarily going that same tried and true path that you know.
Well, and look, I actually, just speaking from personal experience, as you know, John, I've been doing a lot of presentations recently on some of the stuff I'm learning in the fascial manipulation to different associations, and this is in chiro, osteo, myo. And I give people my contact details, and I've had some people, you know, call me up and contact me.
You've had some interesting calls from what you
indeed. But there's two things that really I got highlighted from that. Is a lot of people out there who you may see as competition or, you know, as not aligned with who you are. You'll find that most people are actually pretty open, and they're the kind of people you want in your life. And the other thing too is it's interesting to talk to these people to hear about what they do. And sometimes, like, they talk about stuff that they do clinically, and I'm like, I don't know really anything about that.
Yeah.
And, you know, it's very
sometimes, you know, it's easy to say, oh, that's rubbish.
It was
but
the thing.
You need to consider it at a deeper level.
Well, you know, and like, you know, you hear of certain treatment modalities where I've heard of them and people have just dismissed it straight away. And I think, well, this person's been working for a while, and, you know, from what I'm assuming they probably have some good outcomes. Maybe there's something to this. So I think that's the other thing too, where we need to be careful to not always associate ourselves with people who just think the same way, because it does just reinforce our own bias.
It is. It's just confirmational bias. And it's a natural human trait. It builds on our own psychology that we want to align with people that think like we do, look like we do, all those kind of things. And it builds on, you know, those biases have evolutionary pressure placed on them. It's not that they don't. Yeah. It's just you need to be willing to explore outside of that, because that's potentially where the enjoyable experiences are. All right, on that, I think we've we've probably covered off on a few interesting things there, and hopefully we've provoked some ideas for people to explore. As always, we're really happy and interested to talk to people. So if anyone wants to contact us through any of our social media channels or via our website, feel free to do so at melbourneathleticdevelopment.com.au. Thank you for joining us.